it's important for us to know. And also to then begin your presentation. And Jen, you've got that queued up, and we will be able to see that as well as hear it. So thank you.
I do.
Yeah, so I would say my pleasure, but I feel like every time now I say that, Chick-fil-A has taken over that phrase, and I just think of chicken sandwiches. So. But really, no problem at all. It really is my pleasure. I love speaking about survivorship. I love showing how easy it really is to develop a program. And I especially love sharing the patient's perspective. You know, there's a lot of talk out there about survivorship. Is it really worth it? Does it really work? How do we measure it? Treatment summary, survivorship care plans. So I really wanted to know what our patients thought. Like, did our patients think it was beneficial? And so that's what I want to discuss with you today. But my name is Melissa. I'm a physician assistant at the Colorado Center for Gynecologic Oncology. And I've been there for, gosh, about 3 years now, brought in specifically just to start a survivorship program. One of the most rewarding jobs I've ever had. I love it. So somebody's gonna have to tell me how I click to get the new slide.
So Melissa, you can either tell me when you want to switch, or I can stop sharing and you can share on your end. What do you think's easier?
I don't care.
Okay, let's just tell me when you want me to switch the slides and I'll do it.
Okay. Do the notes at the bottom show up? It's okay if they don't.
They do not.
Okay, that's fine. All right, yeah, we can go ahead and move forward. So let me start with just an overview of the survivorship program. Oh, I didn't change that. Sorry, this has really been thrown last minute, so some of this stuff may be outdated. So earlier this year, I think I'm up to about 133 or so visits, survivorship visits specifically. And the current model that we use at our office is we're only doing one visit after treatment completion, primary treatment completion. So when they're done with chemo, radiation, surgery, when all of that's done, about a month or two afterwards, they come and see me. It's built into their chemo calendar. So when they're first diagnosed and they have their chemo calendar filled out at the very bottom, includes their survivorship visit with me. So they know it's coming. It's kind of something to look forward for them throughout the course of their treatment journey. The length is long, and I'll get into the survey a little bit later about why. These visits usually take an hour and 15 minutes, hour and a half average, sometimes more, occasionally less, but they're pretty lengthy for a reason. So that's kind of what we have going on at this time. You can advance. So what do those visits comprise? Now, I will say that every one of them is a little different depending on the needs of the patient. But as a backbone, we always go over their treatment summary survivorship care plan that's prepared in advance by me. Then we go into a section of preventative health and wellness. And then finally, we use the NCC guidelines patient self-assessment that I review with them about how cancer's affected all other areas of their life. So let me briefly go over what each of those mean. You can advance to the next slide, because there's a lot we cram into these visits. So the treatment summary, we use the Society of Gynecologic Oncology template right now, and it goes over a lot. You can see it here: the diagnosis, the stage, the cancer histology, the pathology, genetic testing, molecular testing, their treatment team, the treatment summary, which is everything. And I think this is one of the most beneficial parts, a one little page or less snapshot of all the treatment and their dates. Very important that I discuss risk of recurrence with them. I want them to know what they're up against, and toxicity of treatments, maintenance treatments, surveillance plan. There's a lot that goes into that, how often we're going to check them, when we're going to check them. Of course, I go over possible signs of recurrence. And I want to pause there for a second. Do I have any cancer survivors on the phone?
Say that again.
Do I have any of you listening a cancer survivor yourself, been diagnosed with cancer?
I am.
Okay, excellent. Thank you. Congratulations, by the way.
Thank you.
Anybody else? Okay. I hate getting in the, it's easy to fall into the conversation of us and them. And I think that's even true just for patients in general, whether you're talking about oncology patients or not. I hate the mentality of us and them, like us providers and them, the patients, because we're all patients, right? Whether you have a cancer or not, we're all patients. Our parents, I just lost my mother-in-law to cancer a few weeks ago. We're all affected by it. So I'm going to be speaking about survivors and patients, but forgive me if that barrier is there, because we're all in this together. I just want to make that distinction. Okay, you can advance. A second chunk that we go over, by the way, that chunk is the biggest part of the visit. And here is where I really get passionate about preventative health and wellness, what you can do to stay healthy after cancer treatment. And this is another template we use from the Society of Gynecologic Oncology. So the research and the recommendations really come from data out of our tumor types. For those of you that may not be aware, gynecologic oncology is female cancers. That does not include breast, because men can have breast cancer. So really it's the cancers from the waist down for females. And this is where we get into the important gap of getting our oncology patients back to their PCP, or making sure they continue that routine and regular relationship with their primary care physician and or OBGYN. We go over cancer screenings, healthy lifestyle. I love to spend time talking about nutrition and exercise, tobacco, bone health for our ladies, and then some of the other topics I've discussed there. You can go to the next slide. The third part of the visit I have them do the NCC guidelines self-assessment for all of these other areas of life, to kind of get them thinking about how cancer may have affected, and to give me a tool from which to move forward on which areas we need to address. Which one of these areas you can see here on the screen, are they experiencing problems, and then how bad is it? Is it something that can wait 3 to 6 months to see if it gets better with time? Is it affecting their daily living, their work? Do we need to address it now? What type of treatment and assessment do we do? So this can get clinical sometimes, like I said, with assessment and treatment. Go ahead and advance. So that's kind of the 3 big visits. Now for me, for anybody that's interested in what goes on afterwards, there's a lot of things that go on after the visit. We schedule follow-ups, surveillance, port flushes, labs, et cetera, any referrals that they need for services that we don't provide in our office. Then I really work hard at the communication with other members of their healthcare team, of course, the primary care physician, and you can see what goes into that. And then we recommend a follow-up survivorship visit 6 to 12 months from when I see them. Sooner if they need me. They can come as many times as they want, as little as they want, but that's kind of the standard recommendation for most. You can advance. So this is what I really wanted to share with you guys, because like I said, I wanted to know what our patients really thought. Is it beneficial to them? So I did a survey the end of last year, beginning of this year, for when about 2 months, maybe more like 4 to 6 weeks. It was completely anonymous. They could mail it in or complete it online. Our ovarian cancer population especially tends to be a little older, so a lot of them don't have access to email. I wanted to make sure that they had access if they wanted to participate. It was only 42 participants, but if you look at how many were eligible for that, it's almost half. I like to say it was almost half, and I think that's a great response. So you can go ahead and advance the next slide. This is what it looked like. I tried to keep it simple and fast. 1 page, check a box, and a little bit of space at the bottom if they wanted to write in more. If you're curious on how we got participation, they had the option at the end of this if they wanted to be entered in a drawing for a free medical massage. We did give one of those away for participants that were interested. But I think a lot of them would have done it anyway, that we just have amazing patients. Okay, you can advance. So I just wanted to show the results of these, and it may be hard for you to see. I don't know how well you can see it on your screen, but over to the left of your screen, it's strongly agree. These are the answers to the questions I posed, all the way over to the right, which is covered up on my screen. Oh, to strongly disagree, with neutral being in the middle. And I'm not gonna go into these a lot. There's some overriding themes I wanted to show you, but how many patients had a better understanding of their cancer type and the treatment? A lot of patients kind of just go with things. They're kind of trying to drink water from a fire hose, especially at the beginning. A lot of our patients get sent immediately to surgery, then they're thrown into chemo. And so a lot is not remembered, even by the time they get to me after they're completely done. So it's important to me that they understand those things. So you can see the answers there. Go ahead and go to the next slide. We also asked upon completion of my appointment, I gotta change my screen here, I had a better understanding of my surveillance plan. Super important for patients to know how we're gonna be following them for any type of recurrence. So I was happy to see those results. You can go to the next slide. Upon completion of the appointment with me, they had learned ways I can be healthier. That's very important. So we had a good response there. You can advance. Upon completion of the appointment, I had learned ways I can reduce my risk of recurrence. Now, I want to stop here because this bugged me. And I think I know a little bit why, if I could assume. There's no data to this. But I worked very hard. It's actually my favorite page of the whole packet. And I try to make a big deal out of it. Save it till, you know, an important point, really get their attention. But as soon, and their eyes perk up, even if I've lost them, they're all like, well, I want to know how I can reduce my risk. So I get their attention every time, but I feel like when I turn the page, no matter how big of a deal, the lead-in I do, you know, you guys know what these are. We've been told our whole lives, we just don't really do them. I flip the page and they see nutrition, maintaining a healthy weight, exercise, and a lot of their eyes just kind of like gloss over. And they're like, I don't want to hear it, I know that. And so it's really hard for me to reel some of them back in and not lose them. So I spend with every patient a lot of time in that section. I'm very passionate about it. So these results were shocking to me. I'm like, what that should be the one that you guys all left with, and the one you wanted to know the most, and I spent the most time on. So the only reason I can get is that, you know, it's just hard. You know, eating well, exercising regularly is hard. When we go over nutrition and we talk about dairy and cutting out dairy, you know, I lose people there. So I just thought this was very interesting result. You can go to the next slide. I received help, meaning that could be just educational resources, referrals, treatments from us, for ways the cancer diagnosis and treatment have affected my life. We had a positive response there. You can advance. I prefer having one long survivorship appointment rather than two or more separate or shorter appointments. This was important to me because when I built this program, I talked to a lot of survivorship programs across the country, and everybody's doing a little different model. 1 visit, 3 visits, we don't even start seeing them till 5 years out, et cetera. So I really wanted to see what patients thought. And as you could say, most of them were cool with that. I think it's because, you know, it's only 1 appointment as opposed to 2. They don't have to do 2 co-pays. This is billed like a regular medical visit with a physician assistant, so there is a co-pay involved, travel time, you know, and they're coming out of treatment where they've been through so many appointments and so many visits. So there was a little, you know, more separation with this answer. But that was important for me to see moving forward with our program if we do want to change our model. You can go to the next slide, please. So I wanted to know, overall, did you think this was helpful? And you can see the results there were just amazing. So I believe it works. Okay, let's keep going. Go to the next slide, please. Was it worth their time? So we know most of them thought it was helpful, but was it worth their time and their expenses, right? Because that's the catch, the drive, the money involved, etc. And we still saw that most patients, all the patients agreed with it, just at a little different level. You can go to the next slide. I wanted to know if they thought they would benefit from a follow-up survivorship appointment. And this was interesting to see too. Nobody disagreed. Some were like, maybe, maybe not. But a lot of them agreed that they would benefit for that. So that's something for us to consider moving forward. It's offered. It's not required and built into their calendar or their surveillance calendar with us. It's just recommended and offered. You can go to the next slide. Finally, the last question is, I would recommend a survivorship appointment to someone affected by cancer. Well, you know, it's one thing if we do it ourselves, but really the proof is in the pudding. Would you recommend that? And that was a great response, I thought, as well. So far, so good, right? At least for me. I'm biased, but I was happy. So let's go to the next slide. I had a couple open-ended questions, and I know these slides are busy, but I put them in here for a reason. What was the most helpful aspect of your appointment? And here's some quotes here. And the notes section, I wish I put some I could see my notes section because I put the overriding themes, but just some really good responses. You can read a plan moving forward, a good place to reset, give me future perspective, checking in, resetting. This is important to me. One said my general practitioner physician also mentioned that the healthy summary provided at the end was a great and extremely useful. I want to make sure our tools, or our communication and the correspondence and the things I'm sending to the primary care providers are beneficial to them. So those are just some examples of things I got back from that question. Let's advance, please. Another open-ended question, any recommendations for improving? How can we make this better? I included a few here I thought are great. One said an email or some type of communication a couple weeks before. Because it's funny because survivorship, what is survivorship? That's a question we all have a hard time, or at least I do, explaining without it being a long answer. People are still confused and vague at what it is. Even though we train our patients, I try to train the staff to communicate with patients what it is. And it's on their chemo calendar. And hopefully I can get the, I'm sorry, somebody's calling me. Hopefully I can get the, I lost it. Can you get it back to me, Jen? Can you hear me? Am I still here?
Yeah, you're still here.
Okay, my screen totally went away. Sorry about that. Technology, I'm not good at technology either. Anyway, so regardless of the training I've done, they get to me, patients get to me, and I'm like, so do you know what we're doing today? They're like, nope, not really. So I think the idea of doing I found it. It's actually, that's my own personal one. So if we can't get the screen back of you advancing it, I'll just do my personal.
It's still visible on our
the
screen.
Yeah, I know. Mine's totally, like, where did mine go? It doesn't matter. I can roll with this, I think. So I love the idea of giving them a heads up of what to expect and how long it's going to be. Okay, you can advance the next slide. Are we on slide where it says number 12 at the top?
We're in number 13. Do you want me to go back to number 12?
Nope. Oh, yes. Okay. Yes, because there's something on there I need to explain. Anyway, they talked about, should we do it earlier, halfway through chemo instead of waiting till the end, which I'm so thankful now we have a patient, a nurse navigator specifically designated for our patients. So I've been able to reach patients during treatment more regularly with her. I would see some of them, but mostly that's just referral from the physicians. It wasn't routinely built into their treatment plan. So we have a nurse navigator that's filling in that gap, which I really appreciate because it's so important to encounter patients early on in the treatment, not just at the end. I put in here, never really got to the question of % chance of likely return of cancer. A lot of patients want numbers. Like, what are my statistics? What are my odds? What am I up against? Give me the numbers. And I never do it unless that has been discussed by the physician. If the physician has, because there's different studies out there for different types of cancer, different answers. So if the physician has discussed that with them and put it in the note, I will talk to them about it. If I don't see record of that, I leave that up to the physician to discuss. But a lot of them really, really want to hear that. Now, I put this last thing in here, saying very arrogant and very cocky. Let me make sure I'm doing okay with time. But I put this in here for a reason for anybody else that may be working with survivorship patients. There was one comment I pulled out. It says, Melissa in this appointment was exactly what I needed for the next step in my life. And I'm getting a little emotional. That was important to me, and I've hung on to that because it just reminds us of the importance of what we're doing, the work that we're doing. And so I just encourage, the point of that is to encourage anybody else that works with patients that this is very, very important, and to hold on to that when you're sick of filling out treatment summaries, survivorship care plans, or dealing with whatever, that this really is important. You can go to the next slide. We're on number 13, correct?
Yes.
Okay, and we're almost done, guys. Hang with me. So what other components, if we were to build this, do more? There's some answers there that I thought were helpful. One says sending out a newsletter to people going through treatment, which made me cringe because I do. I send out a newsletter every month, but it's been frustrating making sure all patients get it, all servers receive it. That's still a work in progress. And then one, I put this here because they said they'd like to have another survivorship visit because they see almost all of them come back every 3 months for our cancer types, see our physicians. And they said those are great, but that's mostly physical health, whereas the survivorship appointment is a blend between physical and emotional. It's more of a holistic appointment. So there's some more feedback there. Let's go to the next slide. The space where I gave them to do any additional comments, here's some I pulled out of it. I felt the program extends a feeling of caring for me individually as well as the well-planned information. Time well spent. Was most helpful, and any questions I had were clearly answered. And I like the newsletter, which means somebody's getting the newsletter. I don't know who, but it's getting out there. All right, let's go to the next slide. This is just something I wanted to point out from, that was mostly results of the survey. This is just some of my insight that I've gained working with these patients over the past few years. I feel like a successful survivorship appointment for me is if the patients get their questions answered and they feel heard, both of those things, then to me that was a successful visit. I want them to be heard, and I want all questions that they have to get answered. Now, if you look at the next thing I put on there, if they are able to share about or reflect upon their journey, their cancer journey, I have found that that's a source of healing. And it's beautiful how it works. Some want to talk about it, some don't. But when they do, it's always a very beautiful thing, and it's been healing. And as a practitioner, that's what we pursue, right? Is health on all different levels. So that has been something I experience in my visits. And then I always try to pose the question to patients of what's next. I don't know if you're going to be my stage 1 that recurs. I don't know if you're going to be one of my stage 4 that live 20, 30 years. I don't know. Nobody knows. We don't know. But let's put that aside and talk about what's next. What do you want for this next chapter in your life? What's important to you? What's bucket list items? What's things you want to do? What's toxic, negative things that you want to cut out? And just really, really want to get them thinking. Some will share, some will just think, but that's a very important thing to me that I have found to be very meaningful in our visits. So one other thing I want to add before we're done. You can go to the last slide if you'd like to. It's just the final slide. There's one thing I didn't put in here that I do want to add, and that's there was a lot of comments. I talk about looking arrogant. There's a ton of comments in there where they specifically mention my name. And I didn't put it in there because it makes it look like I care about me. The point I give to when I present to hospital administration or other people is that the person giving these visits, it doesn't really matter that it's me or necessarily, Sally or John, but the person matters. Like, patients really connect, and the way you speak to patients and handle patients, that really stood out in the comments. So not to toot my own horn, but to say not just anybody can do these as effectively as some. So that sounds arrogant. I don't know how to say that without being arrogant, but if you're looking at developing a program or you're involved in a program, it needs to be the right person because it really matters to the patient. That's the best way I can say it. So anyway, thank you. I don't know if we have time for questions, but I'm all done on my end.
Okay.
Thank you, Melissa.
Yeah.
Thank you.
Very good.
Yes,
Very good.
I think survivorship is definitely one of those things that affects all of us, whether it's in our work or in our personal life. And your point is well taken in the sense that the person who prepares and delivers the survivorship information, whether it's the treatment summary, or the care plan for future, has to be passionate enough to believe and be convincing that they believe in what they're doing. So that relationship is conveyed very prominently in those appointments. So I appreciate your passion for it, and I know it's very time-consuming to prepare these. So that's another piece that's now coming into question as the Commission on Cancer has changed their requirements for survivorship care plans. And there are some people who are thinking that lets them off the hook and they don't have to do them anymore. The challenge was that it's a mandated requirement that didn't have enough staffing or the right guidance, and so it kind of lost steam. But I hear what you're saying in that it's important, at least in helping them transition to the next step. So I know primary care physicians are very interested in this information because they are the ones that are responsible for managing patients after their treatment for the most part. And what we know is that patients after a cancer treatment see their PCP a lot more frequently than they did before. And so the PCPs are not prepared or as well informed without these documents. And I just read some research from NCCN that PCPs are 9 times more likely to monitor and manage survivorship recommendations if they have a plan. So it's important on many, many levels. And so I hope as we move forward, whether we have the COC requirement or not, that people will see the value in taking the time to still do this for patients. One of the questions I had around the PCP relay is how do you actually conduct that? Do you just mail the survivorship care plan and treatment summary to them, or do you actually have a phone call? How does that actually occur?
No, that's a great question. I rarely do a phone call. And that would be the next step. I would like to do that. We had, I forgot which physician it was on a call. Gosh, and I love her. I should give her credit for this, but I forgot her name. She recommended doing that if we can. But no, it is, so they get a copy, I fax a copy of my visit note, just like they would from the physician. I fax the treatment summary survivorship care plan, and then I actually type up a separate additional letter to them so it doesn't get lost in all the medical records. That it's on letter format. It says Dr. So-and-so, and I keep it brief. And the really big things I want them to take care of right now, I put in bullet points right in the middle. So I try to get it to stand out as much as possible, but it still is just facts. I don't do phone calls very often unless it's something I need to address, like a current problem they're having, a diagnosis, a treatment, et cetera.
Okay.
But there's room for improvement there for sure.
Yeah. All right. Any other questions from the group?
This is Becky. Sorry, I joined late, but heard most of the presentation.
Welcome.
Hey, Becky.
Thank you. Thanks for that. That was actually really interesting. I had, I guess, 2 related questions. One is, how do you schedule these appointments? Are they scheduled on their last treatment day, or is there some kind of a reminder system that pops up? And then the second part is, you mentioned that there's an optional follow-up meeting that they can have. And I'm just curious, is that like a passive process? Like, do they call it back if they want to schedule it, or do you have some kind of a follow-up to check in and see if they want another visit?
No, these are all excellent questions and things that I would like to incorporate moving forward. We just haven't yet, mostly due to size and availability. Some of you know I'm part-time. So the appointment is built into their chemo calendar. So our patients receiving chemotherapy, which is the majority of them, have a calendar spelt out from day one of when they're going to be getting which chemo, when they need to go get their labs, a calendar. And so at the bottom of that is their survivorship appointment with me. So that's scheduled for all of them right off the bat. And then right now, the survivorship follow-up is just a recommendation. I have not been notifying them. I would like to start to let them know, hey, your window's here, check in. I actually honestly would like to do a phone call check-in to see how they're doing, or a personal card or something, but we don't have any of that in place. The physicians can still recommend and refer if they think they need to come back and see me. I would say very few come back on their own, though. So there needs to be some type of follow-up to make that available to them. Did I answer that question?
Yep, perfect. Thank you.
Yep.
Yeah.
I would think that,
Hi, Melissa. This is Annie with National Leiomyosarcoma Foundation. This was a beautiful presentation.
Thanks.
This certainly speaks to the article in the Wall Street Journal that was just a few days ago about survivorship. What's next? Did you see that?
I did not, but I'm definitely going to look it up when we hang up.
Yeah, it was in the Wall Street Journal, and I could send it to you because the American Society of Clinical Oncology highlighted the article. And I'm I'm trying to start an initiative that would hopefully be a nationwide thing where we could encompass and embrace what you're doing with the Colorado Cancer Coalition, Survivorship, and palliative care, because I go to patient programs throughout the United States that I coordinate with major cancer centers, and I've talked to the social workers, and they're very interested in having a nationwide network of talking with each other, sharing what has worked for them, what have been impediments, what have been just things that can improve the whole experience of trying to help cancer patients.
Mm-hmm.
What do you think of that possibility?
Yes. I mean, if it really works, if it really brings healing, if it's really time well spent, cost effective, then absolutely we need to do that. I'm all in.
They're all for it. Ohio is, Stanford is. I just talked to Hillman in Pittsburgh, and they're all for that. So stay tuned for what I can pull together.
Go,
and
girl.
also, I just launched an international research roundtable for our particular sarcoma subtype, but it's going to transfer into any sarcoma and possibly any cancer, because as we know, they're repurposing drugs for different cancers. So this is my passion as a caregiver. My husband's a physician and a survivor of this disease, and I just have a passion to channel my anxiety to do this type of thing. And so that's what I do. And so will this what you presented today, will it be offered so that I could print it out?
Actually, we are also recording it, so it will be available as an audio. But are you comfortable with sharing your slides, Melissa, and then we can make those available?
It's not going to go anywhere except just with me. I have newsletters that are
give it to the Wall Street
every
Journal
week.
If it helps, I don't care.
Thank you for that, because I definitely want to make sure you're okay with it. But I do newsletters, and I have 3 websites, and the third website is Life Change: A New Normal. What can be done for you? What can you do for yourself, and how can we help you? So it's really important to me to have your resource information, possibly for that website, because it speaks to trying to get through the journey and staying with it physically and emotionally.
Sounds good.
Thank you,
Very
Melissa.
good.
Yeah.
Thank you. In the interest of time, do we have just 1 or 2 more questions maybe we can address?
Yes, Tommy, I just wanted to make a comment regarding on your survey. Question 1 was a little concerning that such a large number of people come to the survivorship with what appears to be such little understanding of their diagnosis and treatment.
Mm-hmm.
With that said, that also points to the importance of survivorship. If these people aren't getting appropriate education or information, and it could be possibly that it goes in one ear and out the other while you're going through treatment and stuff, which I probably have done in many of the discussions I've had with my doctors and stuff. But it does point to the importance of the survivorship program, and I think it's one of those things that should be somewhat mandatory for everybody that goes through a cancer treatment. I know that I never even heard of the term survivorship or survivorship planning until I saw it posted on the wall a couple of years ago, or not quite even that long ago, when Carlin was hired there at the UC Cancer Center. And I never had the opportunity for that, and I wished that would have been something that existed when I was going through all my cancer and cancer treatment and stuff.
Yeah, I agree.
Yeah.
Melissa, there's been through the American Society of Clinical Oncology, there have been studies that say the oncologists are somewhat reluctant to talk to their patients about lifestyle changes and things that need to be done when it's obvious that things need to be done, like, say, weight management and that type of thing. And they're just reluctant to do that. And then another study from that same organization said that survivorship is enhanced with survivorship care plans.
Mm-hmm.
It actually builds longevity into survival.
Yeah.
It's amazing. Amazing.
It'd be interesting to define the word reluctant. Why are they reluctant, and why? Why?
I think they just don't feel comfortable.
A lot
they just
of it,
feel comfortable, or they don't have time either.
Yeah.
Or they don't make time, or they don't have time. I don't know.
Yeah, and we experience that in our clinic very regularly with the one of the major types of uterine cancer and the relation to obesity and that talk. And it takes time. And, our docs are in the clinic, they're in the OR, they do chemo, they do surgery. So that's why we have other parts of the staff brought on to help address those things. But yeah, you're right. You don't, because they don't want to offend a patient to talk about her weight, or do they not have time? Or that's a good question.
I think it's everything, because I know when we go to MD Anderson, they don't have a lot of time, because it's like a machine over there. There's the volume is staggering.
Yeah, and I don't know the study, but when I was in PA school, I remember researching something on not only do physicians not have the time, but some of the allied health professionals, the PAs, the NPs, not only had more time, but they were better at it for some reasons. I like to bring that up with my docs. I'm like, you know what, maybe you should just let me do it.
Well, even if they share it with, let the patient know that there is integrative medicine departments that encompass all these things too, it would be nice to inform the patient. And that's what we try to do in our patient programs. And we are coming to I'm here in Denver, but we are going to be having a special program for leiomyosarcoma patients on March 14th with the University of Colorado. So I hope to talk with you about incorporating you into that program. You'd be magnificent.
Thank you. That'd be great. And on that last slide, guys, my email's on there. If there's anything I can do to help, I don't know a lot. I'm not an expert in anything, but I'm willing to share what I've learned just so we can embetter patients. Please reach out to me at any time. If you'd like to be on the newsletter mailing list, I think we do a good job with the newsletter. Anything you need, don't hesitate to reach out. You guys know we're all a team in this together.
And we can add that to the agenda so it's part of that document so you're able to access it as well. We can just...
Yeah, that'd be great. I'd love that. That would be magnificent.
In the interest of time, I'm sorry we need to wrap up this discussion, but it certainly is very lively, and I really appreciate the energy and the investment and engagement around this topic. Obviously, there's more to come. So with that, thank you again, Melissa. I really, really appreciate your doing this. And I'd like to move on to the other items of the agenda since we just have 15 minutes left, if that's all right with everyone.
Go ahead.
All right. So Carlin had sent out a survey a while ago with regard to asking people about their specific interest and participation in this particular task force, and identified people who wanted to be on certain committees. Since we are covering both palliative care and survivorship, we needed to have a little bit of a breakout so that as we approach the cancer plan, we have a dedicated team that can take on those topics. So Jen and I are going to be covering the topic of palliative care, and then Carlin is going to be on the survivorship committee. And then we also have volunteers for the symposium that we'll need to collect. So at this time, we have about 4 people who are going to be on the palliative care team, and looks like about 8 people, 7 or 8 people that are on the survivorship committee. Are there any others on the call that would like to be on one or both of these committees as we move forward with the revisions and updates to the cancer plan?
I would like to be on the survivorship. This is Annie again.
Okay, I will go ahead and add your name.
Thank you.
Annie, what's your last name again, please?
It's A-C-H-E-E.
All right, very good. Anyone else that would like to commit to be on either of the committees to help update and revise our cancer plan?
You can add me to survivorship. This is Melissa.
Okay.
Like when and where and the commitment level and all of that, but you can definitely add me to the list to have that discussion.
All right, sounds good. There'll be more to come with regard to refining those parameters for everyone.
This is Tommy. I can't remember if I responded to that or not.
You did. You had chosen to be on the survivorship committee.
Oh, okay.
Is that still good for you?
That's fine. Yes.
All right.
This is
Jen?
Kari. I can help with the palliative care. I know Jen will reach out to me anyways.
Very good. I'll put you on the palliative care group. All right. Jen, were you about to say something?
Yeah, this is Jen Briggs, and I'm interested in learning more about the Survivorship Committee.
All right, very good. All right. Anyone else that I might have missed? All right. And then the next group of volunteers that we're hoping for, and this will be not the first time or the last time we'll ask this, but we have a cancer symposium coming up in November 7th and 8th, and we need volunteers that could be available to help with a variety of tasks at that particular event. We are nearly complete with all of our planning, but there are always tasks and activities that are ongoing up until and on the days of the actual conference or symposium. Is there anyone on the call today that's interested in volunteering with that symposium? It could be a variety of tasks from setup to takedown to helping speakers get to where they need to go, things like that.
I'm happy to help. This is Annie.
Okay, very good. Thank you, Annie.
You can put
Yeah, go ahead, Becky.
Just to clarify, this is Becky. Just to clarify, we'd be looking for folks who can volunteer for the whole day, so either both days or one of the days. And what I usually do is put together a schedule, so you may be sitting at the registration table, or you may be assigned to one of the breakout rooms helping with pulling up PowerPoint slides and keeping time and that sort of thing. So ideally, if you're able to commit to one of the days, that's preferred. Just wanted to mention that.
Okay, very good. All
You can
right.
put Tommy down for both days for whatever you need, as long as it doesn't take a lot of intelligence.
All right.
Sounds good.
All right. And Annie, do you have a preference for one or both days?
Well, because I take care of my mom and my aunt, age 92 and 97, I'll probably only be able to do one day.
Oh, that would still be wonderful.
But I'd love to be at the registration table or whatever.
Okay.
That would be great. I'm sorry I couldn't commit to two. I apologize.
No, that's perfectly
What is
fine. We will certainly enjoy your company and assistance on those days that you can.
I look forward to being with you. Yeah, the two ladies live with us, so
that's
kind of challenging, but we do the best we can.
Thank you.
Thank you.
Is there anyone else that feels comfortable volunteering for the symposium at this point? All right. Well, we will continue to put that request out there and add people as we go forward. All right. As far as the cancer plan and the revision that's coming up, Jen and Becky, do you want to talk more about that?
Sure. Becky, why don't you can jump in, but I just pulled up this document that's also linked in the agenda, kind of talking about what the cancer plan revision team is looking for. So we've already gone through step one, where we looked at the goals and objectives and gave feedback, but now we're going to be moving into step two. Becky, do you want to address that?
Yeah, and I'm going to be adding a few more kind of guiding or guidelines to that I think were mentioned at the steering committee meeting. And I don't have my computer in front of me. I apologize. But essentially, we're not looking to make changes just to make changes, but when you're reviewing sections of the cancer plan that are related to survivorship or palliative care, you'll want to kind of use those questions that are on that document to determine, are there major things missing? Do things need to be revised? Obviously there's some changes now with the treatment summary and survivorship care planning, probably with palliative care. So really using evidence and remembering that the strategies are not meant to be all-inclusive. We are not trying to include every single possible strategy, but what are some big key strategies that have either evidence behind them or are really innovative and kind of emerging practices. So that's kind of the lens you want to use when you're thinking through it. Does that make sense?
Yes. And so these committees that we were just talking about are going to be looking at these more closely. And so we will, Carlin and I will start setting up some times where we can begin this discussion. And then hopefully Becky or Jen are able to join us in part of that and continue to guide us through that process. And then we'll also be talking about other things that are important with regard to the topics of survivorship and palliative care that we may want to incorporate as far as actions or activities that will be supportive in our goals. So the action plan right now, we're not going to focus on a lot right now. Is that my understanding, Jen? That these are the items that we'll be reviewing?
That's correct. We're going to put attention into revising the cancer plan, and then once we have that, really dive into what is the action plan for this task force, and what do we want to do in the areas of survivorship and palliative care. So that's forthcoming.
Yeah, and that's a good reminder that everything that we're putting in the cancer plan is not necessarily what the task force is going to be working on. So don't think like, we can only include things that the task force will work on. The cancer plan is much bigger than the task force, but so yeah. So
I think with the action plan, these are the things that we believe are important and want to carry forward, and it can be supportive of or separate from the cancer plan. Is that correct?
Well, ideally, anything that the task force will be working on is related to the cancer plan, but you don't need to really worry about the task force action plan. I mean, in a nutshell, what that's basically saying is this task force is working on X, Y, and Z this year, and this is how we're going to get to that point. So it's really how you're implementing the cancer plan, but I wouldn't worry too much about it right now. There's no rush with that piece, and we can kind of always revise that.
All right, very good. Thank you for your guidance in that regard. Any questions about either the cancer plan or the action plan for the task force that Jen and Becky can help us clarify?
I have a question about palliative care versus hospice care. There is a difference, right?
Yep.
And I don't think people understand the difference. So when they hear palliative care, they kind of recoil because they think it's hospice care. Is there any value, do you think, benefit to trying to define that better for the patient in the long run?
Yes, and I think, go ahead, Jen.
Okay, there absolutely is, Annie, and that's some of the work that I'm doing here, and welcome anyone that wants to jump in with me. Working on some educational pieces that really show what palliative care is and not clumping it with end of life, because it's definitely has a different component than end of life. I've also put together a state website talking about what palliative care is and have links to resources for patients, providers, caregivers, and an advanced care directive kind of resource page. And then just another area I'm working on is updating the Palliative Care in Colorado report. Down here on the agenda, I did link it right there. So if you want to take a look at that, if you're not familiar with it, that was originally produced by Civic, so Kari's organization. And really what it is surveying all the community-based organizations, hospitals, basically everyone delivering palliative care, so we get an understanding of what the landscape is and then what the barriers are. I've also put together an advisory committee of experts from across the state so they can help on really what our next steps are and where we want to move within the state of Colorado on palliative care. And I do think education will definitely be one of those components.
Yeah, tell me your name again. I'm sorry, I missed it.
It's Jen Kluss.
Jen?
I'm over here at CCHE.
Could you send me what you've got here, the plan? Would you be able to send me a copy of that?
Sure.
Just my name, Annie Achee at AOL.com.
Okay.
Achee, first name Annie. Annie Achee at AOL.com. That would be really terrific, and then that way I'd have your email and I can communicate with you. Because I did put this on one of my newsletters, and I've got to find it for you to give you the resource that I found on it, in case you'd want it.
That would be great.
Yeah,
and
thank
Annie,
you.
this is Kari. Just to kind of echo what Jen said, a lot of the work group work that happens with Civic historically is around education, making sure people understand the differences and how we can better improve understanding and access to palliative care throughout the state. So that is definitely a huge component. And once we get the updated report that Jen is leading the efforts on, we can start formulating those different agenda items, those different work groups to make sure that we're addressing those. And I'm sure that definition and understanding of palliative care is going to be one of those big buckets.
That's great. That's terrific. Thank you.
Very true. Very true. So yes, I think part of it is the language. It's hard for people to say the word palliative care, and then it sounds pretty daunting overall. And so there's a lot of discussion about even what to call it so that people access it more readily.
Right.
So.
Thank you.
Well, in the 2 minutes we have left, I just want to put a plug in for the symposium that, again, is coming up November 7th and 8th to encourage everyone to register now. I think there is a price change that occurs. Is it tomorrow, Becky?
I think Friday is the last day. I'm almost positive
Friday,
it's Saturday.
All right, so that there's a benefit in signing up earlier than later. And we definitely want to encourage you to take a look at that website. The link is in the agenda, and you're able to see also the agenda, the draft agenda for all the speakers and the topics. I've been working with this group since the spring, and we've got some amazing topics, very thoughtful consideration with regard to what's relevant and important for all of you to know, what's timely. We have representatives from most of the healthcare systems. So this is for professionals who are working in delivery of any kind of support or education or clinical care. It is not focused on the patient survivorship day that we had last year, so it's a little bit different audience, but certainly survivors who are working in a supportive capacity on behalf of other survivors would be welcome. So having said that, are there any other questions or recommendations in terms of future topics for meetings so that we can be thoughtful in making sure that we're meeting your needs as well?
This was terrific. Really wonderful work being done.
Yes, yes.
I think
So our next meeting is in November. And we had been toying with the idea of it is a caregiver month and having a presentation on that particular topic. How does that sound for everyone?
Sounds good to me.
Yes, okay. Do you have any recommendations for speakers or presenters for that particular meeting?
You know what would be nice to have is maybe like some kind of a breakout session where people would come together and really share their experiences. I don't know, we have that sometimes in our patient programs, and they really appreciate hearing from one another, you know, because it's an emotional thing to go through, and lots of times they really don't have anybody to talk to.
Yeah, very true, very true.
I think a book list, a book club, maybe. I don't know. I'd like to share with you what I have and see what you think.
Well,
because
as we prepare,
I've just had so much anxiety, you know, from one day to the next, and I thought I better try to channel this into something more productive. So that's why I took this foundation over, and I try to do what I do to talk to patients all over the world, trying to help them for the help we didn't get in 2011 when he got sick. So,
well, I so appreciate the work that you're doing, and we definitely will bring that into consideration as we plan for our presentation in November. So we hope to see and hear from all of you then. And if there are other topics that you are considering, please let us know that you think would be important. I think in January we're going to talk more about the survivorship care plan to see where everything landed. I have somebody from Oncology that is wanting to speak to us about that as well. So any other parting thoughts before we wrap up today?
Well, I was thinking that survivorship includes the caregiver too.
Oh, definitely.
They're part of the journey for their own psyche as well as what they've gone through trying to help their loved one.
Yeah, very, very true.
I think a presentation on palliative care by a provider would be a good one, similar to what we had today.
Yes, and I think we also have some recordings from previous presentations, and I recall there was one from palliative care then, but as Jen does her work, there may be opportunities where we can bring in more of that research too, so yes.
Yeah. Yeah.
All right. Well, as you think of other topics, please feel free to reach out to us through our email in terms of the Cancer Survivorship and Palliative Care Task Force through the coalition, or you can reach out to Carlin or me directly if you have our email, and we will continue to respond and incorporate your ideas to the best of our abilities given the time that we have every other month. So thank you for hanging out with us. We went over a little bit, but hopefully not too much that put you in a position where you're missing any other commitments for today.
Oh, it was great. We have your emails on that last communique for today. We have that? Okay,
yes,
great.
So that is the email that comes into the coalition email, and both Carlin and I monitor that site so we can respond in a timely manner.
Well, thank you. It's a wonderful organization. It's great to be a part of it.
Well, thank you, and thank you for all that you do, Annie. I appreciate you and all of your
thank you. That's very sweet of you.
Today.
Thank you.
Jen, you'll be in contact with the volunteers for the symposium prior to that, or should we just show up and?
Your name's
Tommy, this
on the
is
list.
Becky.
Becky.
Yeah.
Yeah, they'll pass over your contact information, and I'll be in touch with you in the coming weeks to come up with a plan. So yeah, you'll hear from me.
No problem.
Thank you.
Wonderful. Thanks, everyone.
Thanks, everyone.
Take care.
Thank you.
Enjoy the rest
Good
of your
meeting.
day.
Thank you.
Thank you.
Thank you.
Bye-bye. Bye-bye.